Hello, everyone. Wow, wow, wow. I cannot believe we are in the last session of this amazing symposium. Wow, wow, wow. So, for this closing session, I really wanted us to take a moment to express our gratitude to all the attendees, speakers, contributors who made this event a success. Your insights, dedication, and passion have fostered meaningful conversations that will resonate well beyond this space. If any of you were in any of those sessions earlier, something stuck with you, right? I'm not going to go through all of the housekeeping slides because at this point, I think you all got it. So just take a look at the slide. And if you have any questions, you can put it in the chat. You can raise your hand to get a direct message from our tech team. And I'm going to dive right into this discussion and just talk a little bit about what we'll be doing in this session. I wanted to make sure that at the end of this whole day, we left with something, right? Like Denzel Washington said, I'm leaving here with something, right? So after leaving that strong beautiful panel discussion that we just had, talking about, us as leaders, who we all are leaders, right? And then Dr. Mercedes mentioned something about how well-being is important and how we physically feel because body is the B in Dr. ABC's. So we wanted to make sure that everyone gets a chance to join in on this conversation about some of our individual wellness strategies. And this moment is an opportunity to reflect on how we can integrate self-care into our daily routines and maintain a balanced approach to both personal and professional lives. And so let's end this whole conversation on a positive note and reinforce the wellness of the journey that we are going on now. At the conclusion of this final session, we will learn how physical health, including exercise, nutrition, and rest, directly affects mental clarity, emotional regulation, and decision making as a leader. Identify key areas for health improvement that align with the professional goals and develop practical steps to incorporate wellness into our daily routine. Explore strategies to promote a wellness focused environment, setting an example for your team and encouraging healthy habits that support overall productivity and morale. I am excited to introduce you to one of my friends, one of my new friends, Dr. Emma Guzman. She is a distinguished general dentist practicing in New York City, known for her dynamic and vibrant personality. Dr. Emma is not only a skilled clinician, but also a passionate advocate for holistic health and wellness. Her mission to promote a joyful and healthy lifestyle was inspired by her own wellness journey, where the combination of therapy, nutrition, and consistent physical activity transformed her life. Now she's dedicated to empowering individuals to achieve optimal health, both inside and out. Dr. Emma earned her DDS degree from the University of Buffalo School of Dental Medicine and completed her general practice residency at Bronx Care in the Bronx, New York. Beyond her dental practice, she's a sought after speaker, mentor, and community builder. Dr. Emma's passion for service is evident in her participation in dental outreach missions in Mexico, the Dominican Republic, and Jamaica, where she provided essential dental care to underserved communities. Dr. Emma Guzman, welcome, 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 welcome. We both actually spoke recently at the ADA SmileCon conference, and we were over there representing, right? And I just had to have her speak here after listening to how what she shared at the ADA SmileCon conference because it resonated with me. Those of you who have known me since I started here at Zufall would probably notice a big difference in my appearance. I lost 100 pounds in the last 18 months. And it has been one of the most transformative journeys for me. Uh, every weight that I put on me was physically demonstrated, right? All the depression that we mentioned before, and parts of what caused me to be a part of the Great Resignation, all of that I was wearing on my body and it was wearing on my soul, on my spirit, on my mind. And then I shed it, and all of a sudden, I have a new renowned vigor. And then when I heard Dr. Emma's story, she had a similar experience where the dead weight had to come off, right? Dr. Emma, welcome.
Thank you. Thank you for
Welcome.
having me beyond the smile. Because we are more than dental professionals, we are more than healthcare professionals, and we need to focus on self. A lot of times we are in this field because we love taking care of people. But and then who falls by the wayside? We do. So we want to make sure that we could give you guys tools to start your wellness journey. So according to the US Chamber of Commerce Winning and Wellness Report, 1/3 of Americans are overweight or obese. 100 million of Americans have one or two chronic diseases, and over 85 million of Americans are pre-diabetic, and of that number, only 10% know. But when we were doing the survey, only 80% of people stated that they are not ready to make changes in their life to improve their wellness. So with those stats, how does that make sense? Why are we not ready? But luckily, 87% of employers reported that they are willing to offer wellness programs. And since that report was taken in 2016, now about 73% of employers do offer wellness programs. But do employees know about it? How much information are we getting about these wellness programs? And we're going to talk to you today about what useful strategies you could take to actualize these wellness programs, and why aren't you ready to start? Why are you resistant? I know we had a lot of speakers today, and many of them were talking about taking care of ourselves. So we hear it and we listen to it, but are we actually learning? Because for you to learn, you need to actualize the things that you hear. If you don't do it after you leave this webinar, then you just listen. You didn't actually learn. And we want to make sure at the end of the session, you learn today. So let's take it away.
Oh man, I am fired up. I feel like right after this, I'm going to go for a run. Because Dr. Emma, I was one of those, right? Like, yeah, I want to do something. Yeah, I gotta lose this weight. Yeah, I gotta take care of myself. Yeah, my knees hurt. Yeah, but I was so afraid, and I don't know what I was afraid of. I just didn't think that I could do it, right? I have
Hmm.
been overweight my entire life. Since I was a child, I was always the big girl. Always the big girl, just that was just
We're
who I
big
was.
bone.
Right? Like, my bones are big. That's why, I'm from the Caribbean. It's the yam and the cassava. There's always all of these reasons and all of these things. And then coming into healthcare, realizing that none of those things are true. We all have the same skeletal structure. Like, where's all of that coming from? And
Mhm.
realizing that all I needed, which wasn't something very easy, but I needed to be decided. There was a switch that had to go off in me that said, Jay, this is enough. It's over. It's over. You're going to change your life today. And I realized that the only person that was holding me back was myself. And I don't know. When I tell you I'm so proud of myself, I'm tooting my own horn. You go, girl, because I cannot believe I did it. I mean, I am 40 years old, right? Telling my age, I don't mind because I don't look it,
You
right?
don't look it.
40 years old, and this is the first time in my life I could run 2 miles and not pass out. Okay, I can climb stairs and not have aches and pains. And it took me this long to realize that who I wanted to be, I needed to see in the mirror and it needed to reflect on how I felt on the inside. And it only took one decision. So, Dr. Emma, I'm curious, what was the switch that turned on for you to say, I am getting my life in order today?
So my switch was, it wasn't about physical fitness. It was about mental fitness. And it's creating your definition of wellness. What does wellness mean? A lot of the times people confuse it with, okay, we're just talking about the physical, but it's not that. Physical, nutrition, spiritual, mental, right? We need to focus on all those things for it to be true, total wellness. And for me, it was the mental fitness. I've always been physically active. I was on dance teams. I enjoyed working out. I was one of those people who I love going to the gym. But despite that, I gained 20 pounds in dental school. And then after that, we're wearing scrubs. We're working 6 days a week. We're stressed out. We're eating like nonsense. So I just kept gaining weight, kept gaining weight, kept gaining weight. But I was still going to the gym 3 times a week. So what's going on? Right? You go to the gym and then you have a box of pizza when you come back home, make yourself feel better. So for me, it wasn't until I started going to therapy. It wasn't until I started going to therapy and focusing on my mental health, because that's the barrier, right? Like you said, we have to make the decision. Why are 80% of people resistant to making a change? That's mental. That's not a physical excuse. That's a mental excuse. So I had to go back and say, okay, why am I so stubborn? Let's talk about this with my therapist, right? What traumas are not letting me sleep properly? What things went on during my childhood that makes me think I have to be on 100% all the time? Everything is work. Oh, I can't do anything else. I work 6 days a week. I'm doing this, I'm doing that, and I'm not focusing on my actual health, right? Oh, I'll sleep when I die. I don't have time to sleep, right? I don't have time to go to the gym. I have to work. All of those are excuses. And it wasn't until I started handling my mental health, going to therapy, my therapist was asking me about my nutrition. Did you eat today? Because when you're stressed, you don't eat, right? So some
Mm.
people have we overeat, right? When we're stressed. There's some people who don't eat when they're stressed, right? Because I'm not thinking about food. I'm just working because I overwork, right? That's the way I cope with stress. I add more things to my plate, right? My therapist is asking me, how are you sleeping? Sleep. I got to work. I got to stay up all night and work on these things. I got to look at patient charts. I have to work on this treatment plan. I don't have time to sleep. We need to focus on sleep. If you're not sleeping properly, your cells are not rejuvenating. You can't think clearly. How are you going to be an appropriate leader, an efficient leader, if your mind is foggy?
Mm.
I know we love our coffee, but the clarity of functioning on your own will, without any coffee, without any energy drinks, you're just up and you're refreshed. That's a different type of clarity.
Wow.
How are you efficient as a leader if you're groggy, if you're grumpy, if you have pain? My back hurts, my shoulder hurts, my neck hurts. How am
Mm.
I going to be an efficient provider? How am I an efficient leader to my team if I'm coming in late? I have an
Mm.
attitude.
Mm.
All of these come together. All of these come
Mm.
together.
Dr. Emma, but for years we've just been taught to grin and bear it. Like that's part of the hustle, right? You sleep when you die, like you mentioned. You're supposed to keep pushing, keep going, keep going, keep going. And for me, one of the switches was I saw a picture of myself and I didn't know I was in the picture. Like I didn't know who that person was. I was like, who is that girl? And when
Mm,
I realized it was me because it was a picture of the person from the back, I was like, why is this person in our family picture? It was me. And when I saw that and I did not even recognize myself, and also for me, it did take therapy, right? I had to ask that question, and not everyone is able to have a therapist, right? Even though we know that we're therapy advocates, but if you don't have a therapist, you do have a trusted friend, because not everybody's going to tell you, hey, because we know that that can kind of be icky to tell people about their physical appearances, and that can really cause some trauma, so we want to be careful. But one of the things that I realized on my weight loss journey is how differently people approached me, how differently people treated me on my weight down, right? All of a sudden they had something to say. All of a sudden, either you're losing too much weight, who do you think you are you sick, like, but you had nothing to say when I couldn't barely walk, right? When everybody was enjoying all of the things in the amusement park, but I couldn't fit on the rides because the thing wouldn't go down, right? And oh, you wasn't that big. You wasn't that, like that's some sort of a compliment. When the truth is, all I needed was what I had on the inside and that drive for myself. And it doesn't, just because you're big doesn't mean that your blood work is bad or you'll have a negative panel and all of this stuff, right? But it's really mental how you feel about yourself. Is there an alignment with what you see in the mirror, right? So if for you and you see yourself in the mirror and you have, you kind of bigger and you like it, Great. Make sure your mental health is strong. Make sure your physical health is strong. Make sure your blood work is fine. Make sure your heart is fine because we know we are at a higher risk if we're people of color, right? Make sure you're taking care of yourself in every single way that you can. Make sure you're going to your doctor's appointments. Make sure you're making sure that all of your reproductive things are taken care of. As Black women, we are very prone to fibroids. Making sure you're checking all these things so that you're not just taking anything for granted. Because when it comes to our healthcare, especially as healthcare leaders and healthcare providers, we are sometimes the last ones. I was laughing with somebody because they were asking me when was the last time I went to the dentist. And I can't tell you. I can't tell you because the truth is, most of my dentistry I do myself, right? That's my secret, right? Because I really don't have time to go to the dentist. And I'm very skilled with a mirror. So I take care of myself. And good thing I don't have any major stuff to do. But, and that's a shame. That's a shame. I have to say, Dr. Duncan, you should be ashamed of yourself. Look at me telling on myself here. And I do not mind because this is a truth telling session today. So Dr. Emma, what are some ways in which we can practically make that change? Do you have some suggestions? I know Dr. Mercedes talked about sleep and eat, and Dr. ABCs. Oh, when I tell you I'm about to that's going to be my everyday mantra to keep me moving.
Yes.
What are some of your things that you've done to keep yourself moving, and maybe one of the nutritional switches that you made that you saw make a difference if someone wants to just start small?
Okay. Why you took my line. So start now and start small. That's my mantra. Start now and start small. With every single thing I tackled in terms of my weight loss journey, the first thing that I did all that blood work, right? Because the same thing, I looked at myself, I'm almost 6 feet tall, right? I'm 5'11". So I wore my weight well. You're not that big. You do things. You're okay. You're athletic, but I felt it. Right? I felt it in my bones. I was like, I go up these stairs and I'm breathing real heavy. I need to make sure I have my headphones on because I don't want to hear myself breathe when I'm walking. Right? So I started with the doctor appointments, right? It wasn't, ramping up my cardio at the gym. I started with the doctor's appointments, right? Let me make sure I get everything checked out, right? And it was my PCP. I'm going to my GYN. I was like, she didn't mention anything. Hey, can I get my fibroids checked? Can I get an ultrasound to see if I have fibroids, right? Because that could contribute to weight gain. I went to an endocrinologist. How are my glands working? Let's make sure everything's on point. I went to a weight loss specialist and I went to them so they could do metabolism testing, right? Because a lot of the times our barriers is that we give ourselves excuses. So my excuse was that my metabolism is slow, right? So I went and got metabolism testing and he said, your metabolism fine. And I said, oh man, all right, I can't use that excuse no more, right? I got my heart checked out. Why do I feel out of breath when I'm walking? Something must be wrong with my heart. No, it wasn't. My heart was fine, right? So I did all the testing to remove my excuses, right? Now, I was diagnosed with prediabetes years ago, but with changes in my diet, I was able to combat that. But that was my first small step.
Mm,
It wasn't ramping up cardio, it wasn't changing my diet, it wasn't doing this. My first step was checking on my physical body and making sure everything was functioning properly to even undertake this journey,
mm,
right? And then after I did that, then it was okay, what do I like doing? Do I like weightlifting? Do I like doing cardio? Do I want to dance? Do I want to go swimming? Everything doesn't have to be traditionally going to the gym. There's some people who hate going to the gym. Don't go. Don't go. Go running. Go for a walk. Don't even run. I just started running, right? Go for a walk. Walks are amazing. You're able to clear your mind, think about your day. I like to go on walks in the evening and I think about my day. I have my reflection, I have my gratitude, and I'm getting cardio, right? Walking is more efficient for fat loss than running is, by the way. So walking is great, right? Even if you do go to the gym, I'm gonna pump iron for 2 hours. No, you don't. 30 to 45 minutes. Do supersets, do quick workouts, get your reps done and get out. The reason why people are in the gym for 2 hours is because they're on their phones half of the time. You don't have to spend that much time at the gym, especially if you don't like it. Go to fitness classes, right? Go to dance classes, go swimming, do what you
Mhm.
like to do. This shouldn't be a punishment.
Yeah. Yeah.
Taking care of your physical health should not be a punishment, right?
Mm.
How do we incorporate this to our daily life? I have a calendar. We have our calendar of our work meetings. We have a calendar of everything we need to do, right? In my calendar, I put when I'm going to the gym.
Mm.
With the job that I had, I started different times every day. So 2 times a week, I started at 6 a.m. I know. 2 times a week, I started at noon. So if I'm starting at 6 a.m., I am not the 4 o'clock in the morning person. I'm not. So I know those 2 days, I need to carry my clothes. So I go to the gym right after. Now, when I start at noon and I'm getting off at 8 p.m., I'm also not the 10 o'clock girly, right? So I know I need to go to the gym beforehand. Have your fitness as a part of your professional toolkit. It's a part of your workday. Schedule it.
I
Gym.
love that. I love that,
Gym is
Dr.
in my
Emma.
schedule
Yeah.
before and after.
Yeah, and I think a lot of us, like the gym goers, like to post their picture on Instagram. Look, I was at the gym, and then some of the other non-traditional ways of movement don't seem as Instagrammable, right? So like walking, like nobody's gonna be impressed at that, right? Like you're supposed to have on
I
the
post
waist
when I'm
trainer
walking.
and
I'm just
post,
like, I'm on a walk, okay? And I post it on my Instagram.
and
And I talk about the benefits of it.
yeah, yeah, yeah. And for me, gym is not my best friend. I do, there's a lot of trauma with the gym and the judgment and stuff, even though
Absolutely.
even though my physical fitness is more in line with where I want to be now, but it's still traumatic for me. And then I discovered Pilates, right? Pilates class is fun, it's engaging, there's movement, there's stretching. You start to hold your head up high, your posture helps, it helps with the aches of your bones. Find something that you like. And if you like to dance, and you really want to do Zumba or you want to learn African dance or you want to learn the waltz, move, move your body. Move your body. If you don't want to pay for membership, put on some music and just shake it in the house, right? Just have a good time. Pickleball. I mean, the chat right now, I mean, you guys have no behavior. You
The
guys are going
chat is
off
lit.
in the chat, right? Everybody is like, yeah, this is crazy. Somebody told themselves that they haven't gone to the dentist. Dr. Lee, I'm calling you out. I'm calling you out because I'm not going to be out here by myself. So make that appointment, Dr. Lee. And
I can't tell
so
you when was the last time I had a formal appointment.
true talent session. That's right, Miriam. Okay, so I could talk to you forever and ever about this, but unfortunately, we are running out of time. So we will set up something else where we both could talk
Yes.
again. And, but I really just wanted to leave this symposium in high energy after a long day. I know we kind of wind down and get kind of sleepy and snooze festy. No way, not at Zufall. We end with high
No.
energy and we let you know that there's something you can do today to change your life. You figure out what that is, but do it. Do it. Do it. Do it. I'm so excited to hear the feedback from whatever you decide to do.
Start now, start small.
Thank you so much. So thank you, Dr. Emma, for your insightful contribution. Your expertise and dedication are truly appreciated. I just want to give some thank yous if you guys could bear with me for about 2 minutes. I want to give a huge thank you to Dr. Day Walker, our keynote speaker, our speakers from the Department of Health, Dr. Taiwo, from NAC, Dr. Padilla, Henry Shine, Allison Neal, Meg Meadow from the Million Hearts team at the National Association of Community Health Centers, Amy Aldward from the MPCA, the Michigan Primary Care Association, Dr. Mercedes from our very own Zufall, Dr. Webb from Brilliant Smiles Pediatric Dentistry. I heard her session was amazing. Dr. Giacona from Zufall's Dental Department, Dr. Gannon from Zufall's Medical Department, Dr. Grover from the American Dental Association, Dr. Bishop from Zufall's SVP of Medical Services, Sarah Ailman, Zufall's SVP of Behavioral Health Services. And again, Dr. Emma, a wellness coach on her journey to help healthcare practitioners live their best lives. To our wonderful sponsor and exhibitors at Delta Dental, Henry Schein Cares Foundation, NAC, Align Technology, Benco Dental. Also, a huge thank you to the Zufall Health Foundation for the continuous support in all of our efforts to bring forth access to quality healthcare and education to our communities. Our CE sponsors, ADA Serve, New Jersey Hospital Association, and Rutgers School of Public Health. Wow, so many partnerships went into making today possible. And lastly, I cannot finish this without giving a huge thank you to our internal team. Fran Palm, our Chief Executive Officer, thank you so much for giving us the opportunity to do this. I really appreciate the trust that you put in us to be able to put forth this. Thank you, thank you, thank you. Dr. Ramirez, who is one of my biggest cheerleaders. She is the best boss in the world, our Chief Medical Officer. Thank you, thank you, thank you, thank you, thank you. Christine Barney from our development department. David Woods, our Director of Development. Lauren Karras, Miriam Rosinski. Oh my gosh. Clap for these two individuals, two of the most organized people I've ever met in my life. They are superstars, okay? Brian Wang, our CIO, Melissa Toro, Kelsey Orr, Afaf Alwani, Daniel Barantes, Brandon Gonzalez, Anthony Matamoros, and Michael Shaheda. Thank you, thank you, thank you. Be on the lookout for post or conference emails with notifications of all of the conference survey links and our CE survey links. And we're also going to come and elicit your feedback to see how we can make next year even better. We're offering a total of 6.5 credits for CDE, CME, nursing, public health, chess, and MChess. And you must complete the CE surveys for CE credit, and you have until 11/27 to get your CE. Remember, for those who have looking for CDE and CME and CNE credits, make sure that you do a survey for each session, and that survey will be found on our website at the end of this. So thank you, thank you, thank you so much. To wrap up the day, I would like to give a special shout out to our very first registrant, Lynn Tobin, the Associate Professor of Dental Hygiene at Middlesex College. She joined in probably on the first day that we opened up registration. I don't even know how she heard about it, but Lynn Tobin, you about to get a prize. Somebody's going to reach out to you, send you an email to get your address, and we're going to mail you something for actually believing in us and seeing Zufall and our symposium and thinking that it was worth you paying this $25. Thank you, everybody. Have a good day and a great weekend. Bye bye.